Anatomy. The elbow is made of the humerus that articulates with the radius and ulna. The capitulum is the lateral distal part of the humerus, and the trochlea is the medial distal part of the humerus. From a medial view, the coronoid process of the ulna is anterior to the medial epicondyle, and the olecranon is posterior to the medial epicondyle. The trochlear notch sits between the humeral medial epicondyle and the ulna. On the medial aspect of the elbow, we can see the humeral medial epicondyle, considered to be the main insertion point of the common flexor tendons, including the pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, and flexor digitorum superficialis. On the lateral aspect, we can see the humeral lateral epicondyle, or the main insertion point of the common extensor tendons. The radial head is directly distal to the lateral epicondyle. The apex of the elbow is formed by the olecranon process. When the elbow is flexed at 90 degrees, the apex and the two epicondyles form an isosceles triangle. When fully extended, they form a straight line. We can identify the medial and lateral paraolecranon grooves. The ulnar nerve is found in the medial paraolecranon groove just posteriorly to the medial epicondyle. From medial to lateral, we can identify the distal tendon of the biceps muscle, the brachial artery, and the median nerve. From the lateral side of the elbow, moving anteriorly to posteriorly, we can feel the biceps brachii, followed by the brachialis, then the brachioradialis. The radial nerve may be felt in the interval between the brachialis and the brachioradialis. Then it passes laterally in the elbow and enters the radial tunnel. In the tunnel, it runs just below the supinator muscle. The olecranon bursa sits directly on top of the olecranon process and inhibits any skin tension when we move the elbow.